Hi, my name is Ashley with Dr. Mark Hamilton and Follicles Hair Loss Clinic. Today we will be speaking with Mike, one of our actual patients, during his hair transplant procedure.
Hi, it's Dr. Mark Hamilton, and we're doing a hair transplant today. And Mike, our patient, has been nice enough to allow us to film him so you can get an idea of what this process is a little bit about. And prior to what we're doing right now, Brian here is putting some grafts in. Prior to all of this, we actually took a small strip of hair from the back, and then our technicians did an excellent job of cutting that into little tiny grafts. Mike, what was that harvest process like? You had a little bit of discomfort while we were injecting, doing the numbing, but not too bad?
Not bad at all.
Yeah.
The numbing process was like little needles going across a section of hair, and it it stung a little bit. On a scale of 1 to 10, it was maybe a 3 or 4. Not bad at all, and it only lasted about 30 seconds, approximately.
Yeah, good. Mike's also had some Valium, so that helps just to relax things. Some patients do, some don't. And then once we've done that, we move to the front, and we do a little bit of numbing up there as well. And then we make tiny little incision sites where we put those grafts. And we'll show you here in just a minute what that looks like. Okay, so here we're looking at Mike's recipient area, and these you can see little incision sites as well as little grafts that are already in place. And as we come over to this area here, you can see there's several openings, and Brian's just going to put some grafts in there just like that. And that's how we put the grafts in. We just slide them right in, and they actually seal in place within a matter of hours, so that there really isn't any stitching or any glue. They just seal right in that pocket. So we're here with Mike, and we're just continuing to place the grafts into the recipient area. And Mike, how are you doing with all this?
There's absolutely no discomfort right now.
Yeah.
Feels very good.
Yeah. So once things are numb, patients really do pretty well with all of this. Probably the toughest thing is in the longer cases, you have to hold still for a while. For real active guys, that can be tough, but Valium can help. You can't see, but Mike is actually watching his favorite television show right now, so we have that to entertain you as you go as well. Mike, any comments about the process at all?
I could read a paper.
Yeah.
I could fall asleep. The back of the head, when you took the grafts out, I guess that's the harvesting of the hair, absolutely no discomfort there. The only little bit of discomfort that I had was the actual numbing of the area, which wasn't bad. Again, on a scale of 1 to 10, it was might have 3 or 4 or 5, but it only lasted about a half a minute at the most, and not bad at all.
It's good.
Yeah, really overall, a great experience.
Good.
Yeah.
Good. So this has been Dr. Mark Hamilton, and we've been doing a hair transplantation.